Hello and welcome to my channel. This is the first lecture in the dental series. This is a complementary series. I mean, it completes the general anatomy of the head and neck and thorax, those required by dental students. And in this series, we will go through the anatomy of the tooth and cranial nerve nuclei, and mastication. So let's begin the first lecture. We're referring to the human teeth. Of course, they are there for the breakdown, mechanical breakdown of food, by cutting and crushing and grinding of food, to be prepared or to prepare food for swallowing and digestion. And there are four types of teeth: incisors, canines, premolars, and molars. The incisors cut the food because they have sharp edges, as you can see here. The canines tear the food. The premolars, or the bicuspid, and the molars, they crush the food or grind the food. The roots of the teeth, as you can see here, are embedded in the upper jaw and the lower jaw. Lower jaw being the mandible and the upper jaw being the maxilla. Humans are diphyodont species, means they have two sets of teeth. The primary teeth, or the milk teeth, or the deciduous teeth, they are 20 in number, and they are all replaced by the permanent teeth, which are 32 in number, 18 in each jaw. The deciduous teeth normally start to appear, or eruption begins at the age of 6 months, but sometimes babies are born with a tooth or two. This is called the natal teeth. Okay? Normal tooth eruption begins by the age of the 6 months. Now, for the anatomy of each tooth, we have the crown. This is the area, this is the portion of the crown above what's so-called the cemento-animal junction. Cemento-animal junction. This is the cementum. This is the animal junction. The crown is composed of dentin, as you can see here, and the pulp chamber, which is present at the inside. The root is found below the cemento-animal junction. This is the root, and is covered with the cementum, as you can see here, this blue line, or this blue layer. And the dentin composes also the root, and normally has a pulp canal through which the blood vessels and nerve enter the pulp chamber inside. Canines and most premolars, except for maxillary first premolar, usually have one root. Maxillary first premolars and mandibular molars usually have two roots. Maxillary molars usually have three roots. More roots than that, or supernumerary roots, this is sometimes happens, and there's usually 20 primary teeth in both jaws, and 32 permanent teeth in both jaws. This is the set of permanent teeth. These are the two incisors, the medial and lateral incisors, then the canine, and the two premolars, or the bicuspid they call it, and the three molars, the first, second, and third, which is the wisdom tooth. This is the lingual side, or the buccal side, and this is the facial side, or the side that faces the cheeks. Okay? The primary teeth is the set of teeth you see here. These are the permanent teeth, high in the maxilla and below down in the mandible, as you can see here. These are the permanent teeth. Now, talking about the primary teeth, they are 20 in number and 10 in each jaw. With the formula goes as follows: 2102 over 2102 means 2 incisors, 1 canine, no premolars and 2 molars in the upper jaw, half the upper jaw. So that's 5 times 2 for the whole jaw. That's 10 times 2 for both jaws. This is 20 teeth. There are 2 types of incisors, as mentioned before: central and lateral incisors, and canine, of course, and 2 molars, first and second molars. These primary teeth will be all replaced by permanent teeth. Now, there's a system called the universal numbering system. It designates, the teeth on numbering basis from the dentist perspective, as he the way he looks at the mouth. Starting with tooth number 1, which is the right upper third molar, and you go to the left side till the number 16. That's all the upper jaw. Then you begin the lower left third molar as 17 and go to the right until 32. This is the lower jaw. So 16 above and 16 below, that's 32, and this is the order you count the teeth. Of course, you can see here that 8 and 9 are the medial or central incisors, 7 and 10 are the lateral incisors, 6 and 11 are the canines in the upper jaw, and so forth. You can go through all the tooth numbers. The formula for the permanent teeth is 2123, means 2 incisors, 1 canine, 2 premolars and 3 molars in each half of this is the upper jaw here, and this is the lower jaw. The third molars are called the wisdom teeth, and sometimes they don't erupt at all, and when they erupt, sometimes they need to be taken off, and if more than 3 molars appeared, like 4th and 5th, this is called hyperdontia. It means supernumerary teeth, and if fewer than the normal number of teeth occur, this is called the hypodontia, the opposite of hyperdontia. Okay, there are differences between the male and female teeth. Male teeth are larger and contain more dentin in proportion than the females, but the females, of course, smaller teeth and contain more enamel than the male teeth. Parts of each tooth. The enamel is the outer part that covers the crown and is the hardest and most highly mineralized substance in the body. It develops from oral ectoderm, and it's composed of 96% composed or consists of minerals, with water and organic material comprising the rest of the 4% of composition. And the normal color of the enamel varies between light yellow to grayish white. It's a semi-translucent substance, so it can reflect the color of anything that underneath the enamel, like the dentin, for example, can affect the appearance of the tooth because the enamel is semi-translucent. It varies in thickness. It's about 2.5 millimeters at the cusp, and thinnest at the border here at the cemento-enamel junction. It reaches, it's the thinnest part at the border. The wear and tear rate of the animal is called attrition, and it's about 8 micrometers a year for normal factors affecting the tooth. The primary mineral in the animal is hydroxyapatite. It's a crystalline calcium phosphate, and the minerals account for the strength and brittleness of the substance of the animal. The dentin is less brittle and less mineralized, so it's rather softer than the animal, but it provides support for the animal, which does not contain any collagen. The proteins of the animal are the amyloblastins, the amylogenins, and the enamelins, tuftilins, and they aid in the development of the animal by serving as a framework support, these proteins we talked about. Dentin, on the other hand, is the substance between the animal and cementum and the pulp chamber. It's secreted by odontoblasts present at the edge between the dentin and the pulp chamber. Formation of dentin is called dentinogenesis. It's composed of 70% inorganic materials, 20% organic materials, and 10% water of the weight of the substance. And it's softer than the animal, that's why it decays more rapidly and subject to severe cavities if not treated early. And but still it acts as a protective layer and supports the crown of the tooth. It's mineralized connective tissue with an organic matrix of collagenous proteins, and it has channels called dentinal tubules. The one you see here, they are somewhat branched, but they do not intersect, and they go through all the way till the outer surface here of the dentin, which the margin that reaches the or in contact with the animal. Diameter ranges between 2.5 micrometers and 1.2 micrometers and 900 nanometers near the dentino-enamel junction, which is the thinnest tubules has this region. Also, there are primary, secondary, and tertiary dentin. The secondary dentin is the one produced after root formation and continues to form with age. The third or tertiary dentin, which forms due to stimuli like cavities, for example. You can see here the tertiary dentin is forming. Cementum is a bone-like substance, covers the root of the tooth. This is the cementum here. It provides an attachment for the periodontal ligament to attaches to the tooth for its stability. And it's approximately 45% inorganic material, mainly hydroxyapatite, 33% organic material, mainly collagen, and 22% water, and is excreted by cementoblasts within the root of the tooth. The cementum is acellular at the cemento-enamel junction, and it covers the acellular type covers about 2/3 of the root, while at the apex of the root there is the cellular type of cementum, and it covers about 1/3 of the root. The dental pulp, which is the cavity inside, it's connected by a dental canal to the outside, and through which there is a nerve and blood vessels passing to the dental chamber, the pulp chamber here, as we can see. It contains connective tissue, and within this soft connective tissue blood vessels, and nerve endings. Along the border between the dentin and the pulp lies the odontoblasts, the cells that form the dentin. And other cells in the pulp include fibroblasts, pre-odontoblasts, macrophages, and T lymphocytes. The pulp is usually called the nerve of the tooth. This was a summary of the anatomy of tooth. I hope you got the maximum benefit from this lecture, and thank you very much for watching.